Good morning on this Let's Talk About God. Today I'm going to call this video Academic Bullying. Yeah, that's what I'm going to call it, Academic Bullying. And I'm talking today about psychiatric institutions, asylums, mental hospitals in the UK, in this country. As you know, I've been inside a psychiatric unit. I went in there claiming to be God, just to see basically what sort of treatment I would get from these people. And I quite like doing these undercover little jobs, I quite like it, because, I get to see the true colours of people, But what I want to say is, it's not all as polished and as professional as the public might think what's going on, because I've been in these places and behind the scenes, so I know exactly how they operate. And there's a lot of what I would call academic bullying going on. Now, the psychiatrist, before he becomes a psychiatrist, he has to swear allegiance to the fact that he will not, in his practices, he's not allowed to harm another person. That's part of their oath. It's a psychiatric oath that they have to swear by, right? You can ask any psychiatrist; they'll tell you that that's what they have to do. Before they take the job on, right? That they will not harm people, deliberately harm people. But that's exactly what's going on. They are deliberately harming people. Yeah, because what they do, I'll tell you what they do, right? On a normal psychiatric wing, you may have, and the one I was on, I won't say the actual place, but the one I was on was like there was like 16 patients, and there was 30 staff members and a psychiatrist, a psychologist, therapist, and all these sort of people. Right. All professionals, all supposedly academics, right? Now, what they do is they do something called a ward round, and they do this ward round once every 2 weeks. You don't see the psychiatrist every day, you see him once every 2 weeks, sort of thing, right? And what happens is you go in a room and you sit down, and they're all in a semicircle around you, all these so-called academics, these professionals. And based on basically how they feel on any one particular day will depend on how they treat you in that ward round. Now, they give you leave to... these wards are locked down, right? You can't get off the ward. It's all locked. There's all bars on the windows and everything, and they're completely locked down, right? And they'll give you, with a staff member, 45 minutes leave 3 times a week. That's the only leave you get. That's the only time you can go in the garden, but you can't actually go on leave unless you get 45 minutes a week, right? And also if you're like a good patient or whatever, they might give you some town leave, a couple of hours to go into town, or they might give you some time to go shopping and do a little bit of shopping and that. But basically, you're locked up and caged up like a wild fucking animal, which is no good for anybody, right? It's no good for anybody to be like that. Also, they will coerce you to take their medication. It's not the fact that you're taking medication. What they do is they make sure that, they change and switch the medications as they see fit. Even when the medications give you severe, and I mean fucking severe, side effects, horrible side effects. The psychiatrist is well aware of what it's doing to you, but he will still push it on you. Basically, the psychiatrist is acting like God, which is a fucking dangerous thing to do, but that's what they're doing, right? And the staff are basically, most of them are just bullies. Now, there are some nice staff I've met through the years, and there are a couple of nice doctors that I've really admired, that are very good doctors and mean the best for you. But what I'm saying is the majority of doctors and psych nurses in these places are pure fucking evil. And they're horrifically treating people, in these systems like they're bullying. It's the way they talk to you. They talk to you like you're a piece of shit. Yeah, like you're not worth nothing. Like they're high and mighty above you and all this. They condescend, patronise, and talk down to you and pull you aside and tell you off, and it's going on all the fucking time. I have a thing called a seclusion room. I've never been in that one, but they try to get everybody in there, yeah. And then they leave you in there for weeks, mate. You might think you're going to go in there for 24 hours. No, they'll keep you in there for weeks. And they'll sit outside the door, look at you, and people go mad in there. And there are a lot of people that have slipped through the system that are not mentally unwell, and they end up, like myself, inside these places. I was in there for 5 years. The doctor was hell-bent on saying I was a nutcase, I was dangerous and all that. I got out. There's never been a problem with the police or the public or anything. So that proves him wrong, doesn't it? The one that thinks he's God, the one that thinks he knows it all, because he went to psychiatric school, mate. The fuckhead didn't even know I was a producer. I never told him. I never told him that I knew how to do things, right? He thought I was some kind of dumb cunt, mate. I played dumb, yeah, I'll go along with your story, idiot. But I'm telling you, these places are pure fucking evil. And there needs to be a fucking complete overhaul of the powers of psychiatry and mental health nurses that are dealing with patients. Because the way they're acting and the way they're carrying on inside these places is cruelty. It's cruelty against other humans, right? They're put in a position of power, and they should be able to manage that job in such a way that everybody gets the utmost respect. But that's not what's going on. They're degrading people, they're bullying people, they're forcing medications on people to make people fucking sick. And I nearly died in hospital, yeah? Right? I got constipated because of the medication the doctor was putting me on. And they still, and you know what? No apology. They wanted to do a blood transfusion on me. They wanted to cut me open to find out what was going on because I was bleeding and all this, yeah? In the end, I had some very, very powerful antibiotics and I actually, got out of this horror house, right? But these people are not as squeaky clean as you might fucking think. No, they're bad fucking evil people working in these places, mate. And there needs to be a full investigation into mental health facilities through this country and what's going on here, right? Like I said, I've met a few nurses, psychiatric nurses, and doctors that are on the ball and know what they're doing. But there's some fucking cowboys in there, mate, right? That are really fucking nothing but fucking arseholes, mate. Yeah, and. Psychologically, they're breaking people down that don't deserve to be broken down, that don't deserve to be punished. People, and and if you do anything at all that upsets these doctors or these nurses, they will severely punish you. They either like weeks or a month inside the seclusion room, right? Or change your medication, give you stuff that they know is going to fuck you up, and they know it's going to. Really have very bad side effects, which they don't give a fuck about. They don't care how much you're suffering. My eyes were constantly stuck on the fucking ceiling for fucking near enough a fucking year until, I jumped off the medication and said, listen, this medication's no fucking good. These idiots don't change it. You know what I mean? And this is the truth about mental health hospitals in this fucking country. It's a fucking debacle. It's a fucking horror house. It's a fucking horror show, right? And these these so-called fucking psychiatrists think they're so fucking clever and cocky behind the scenes because no one can fucking see what they're up to. Well, today I'm telling the fucking world about them, yeah? Yeah, I'm telling the world about all these fuckheads, mate. And that's what's going on inside our mental institutions, our mental hospitals. Anyway, so on this Let's Talk About God, I'll catch you in the next video. Bye-bye.